Hi, this is Dr. Pelto. I want to go over with you a presentation I did recently called Keeping Your Feet Healthy with Diabetes. So let's begin. First of all, why you should listen to this. I did this presentation for a couple of groups recently, and a lot of them were helping work with people with diabetes and trying to prevent different types of problems. And really, the reason people should listen is because you or a loved one will probably develop diabetes sometime in your lifetime. 1 to 4% of people with diabetes get ulcers every year. So that means if you take a group of people that have diabetes, a small portion of them will get wounds, okay? But sometimes it's the same people over and over again, because I find that the people with diabetes that is not well controlled, and if they develop one ulcer, they'll probably get another one. So 15 to 25% will get one in their lifetime. So it's 1 in 4. So this is a serious issue to try to prevent these. Now, the bigger challenge comes when 15% of these ulcers can lead to amputation. And that's what we really want to prevent as podiatrists and healthcare providers. And 85% of amputations start with ulcers. And so if you have an ulcer, you're at much greater risk of developing an amputation. And then, really, this is the results that came up by Dr. Armstrong, is that 45% of people with an ulcer die within 5 years. And that doesn't mean that just because you have an ulcer, you're going to die. What it means is that an ulcer is kind of like the tip of the iceberg. So if you look at all the other health conditions that are going on, you may be unhealthy, you may have high blood sugar, high cholesterol, other things like that can really just make your health overall bad. You may not die from the ulcer, but it may be from the other issues that are kind of going on there. Throughout this presentation, I want to go through some of the diabetic foot care recommendations. These recommendations are really for patients and healthcare providers. So yearly, what I recommend is that everyone get a comprehensive diabetic foot exam at least once a year. This should be done by a podiatrist or someone similar to that. Just because your primary care doctor looks at your feet, I don't recommend that as a comprehensive foot exam. I'll kind of go into detail what's included there a little bit later if you want to learn. Also, I recommend a yearly diabetic footwear with the inserts that are changed every 4 months. These are some multi-density inserts. They actually have 2 types of material that reduce the friction. Every 2 to 3 years, 2 to 3 months, I recommend some type of foot care based on your symptoms if you qualify, and then every day check your feet. This last one, I know it seems very simple, but if someone wants to prevent a foot problem, the most important thing, in my opinion, is to check your feet every day, just to look at them. Look at if there's any problems, look if there are any cuts, any wounds. Now, a lot of patients have this disease I call the Dunlop disease. It's where your belly dunlops over your belt buckle and you can't get down there. And if you have that condition, you can have a loved one look at your feet. There's also a high-tech method that I like to explain to everyone. Nowadays, a lot of people have these special iPhones and iPads, and what you can do is you can put the iPad on the ground, and you can hit the record button and just put your foot over the top and take a look, or you can take a picture of it. But you can see the bottom of your foot with the iPad. That works really well. I want to start with a patient story. This is a story of a patient of mine, and she had come in. Initially, she had a callus that I was treating for many months. That callus developed into a wound, and she was seen in the emergency room. And we ultimately had to do surgery. We had to open up the bottom of her foot, and this took many months, actually years, to heal. But the story really wasn't about her. The story was about her husband, that was her caretaker. And he, as you know, when you're a caretaker, you tend to forget about yourself. He also had a foot issue, and he didn't have me look at his foot. That's why when anyone comes into the office now, whether or not they're the patient or not, I have everyone take off their shoes and socks so I can take a look at their feet. He ended up having a condition called gas gangrene, which was a condition that actually ended up losing his leg. And the reason I tell the story is that she had taken a number of years to heal this foot wound, and she still has a foot. But he had a prosthetic made in about 6 months, and he was back walking. And so, as you can see, an ulcer can take a lot longer to heal than even an amputation. That's why sometimes different types of doctors recommend amputations. I'm not advocating that. I'm just kind of using that as an illustration. So I want to talk to you today about 3.5 ways to prevent a foot wound. So first, the most important thing that patients can do is examine their feet every day. This is really by far the best thing that you can do. Very easy to do with, once again, a mirror or some type of electronic device to take a look at the bottom of your foot, or have a loved one look at your feet. What are you looking for? Any cuts, any scrapes, any redness? A lot of times people with diabetes, they don't recognize the problem until it's too late because they don't have the best feeling on the bottom of their feet. Next, make sure you wear the correct size shoes and diabetic shoes. A lot of people say that diabetic shoes are ugly. I have one colleague of mine, he says that, well, it's better to have an ugly shoe than have no foot. But what I find is that the diabetic shoes, they tend to be improving over time. They have some special inserts in them, and they're very, very effective for reducing types of foot problems that you'll have. Your doctor will explain when and if you qualify for these as well. Have a professional do your nail care and trim your own calluses. Don't take a razor blade to trim your own calluses. If you have an ingrown toenail, don't take care of it yourself. You should be seeing a professional to prevent any foot problems. And also take responsibility to learn more. Have a yearly foot exam. No matter who you go see, take off your socks and shoes. It doesn't matter if it's your primary care, if it's some other type of doctor. You shouldn't just be taking off your shoes and socks for your podiatrist, but everyone. Have a foot doctor, have the doctor look at a revisit. And there's something also I put together. It's called the Diabetes Toolkit. This is something I find that's helpful for patients, because a lot of patients I see, when it comes with a husband and wife, and they both come in, and what I see is that the husband, for example, has the diabetes, and whenever I ask him a question, he always looks at his wife. And I ask, well, how is your blood sugar? He looks at his wife. How is your foot? He looks at his wife. He doesn't want to take any responsibility. So I think the most important thing, if I can pass something on, and even if you're a loved one watching this or a healthcare provider, is to have your patients take responsibility and learn more. And one way I've done that is putting together this thing called a Diabetes Toolkit. It's a list of resources that I put together for people that have diabetes. You can find this on my website, drpelto.com. It has introduction, information about foot, wounds, sores, kidneys, eyes, other types of things like that. It's not to replace medical care, nor is this lecture, but I find it quite helpful for people. So you can get that just by going to drpelto.com and clicking on the Diabetes Toolkit if you'd like to learn more. Let's go on. A lot of my patients ask me who qualifies for diabetic shoes. So I'm going to show you kind of what the guidelines say. You have to have diabetes and one of the other following conditions. That's a previous amputation, a history of a foot wound, a pre-ulcerative callus, peripheral neuropathy, a foot deformity, and poor circulation. I went through those kind of quick because I like to show you pictures. So here's the pictures. So if you have an amputation, if you lose one toe or part of a foot, you can get a special diabetic shoe with a special insert. If you've had a sore is really just an erosion into the level of the skin here, and this kind of the area erodes in there and creates a sore. If you've had a pre-ulcerative callus, this is a callus that it's not an ulcer, but you can see it's over a bony prominence and could cause a problem in the future. And as well, you can see here, these are some hammer toes that could become a problem in the future if they rub on the top of the foot. Two other things that can qualify you for shoes are having poor blood flow and poor neuropathy, or poor feeling in your feet. If you have any of these conditions, you should talk to your primary care doctor and have them see if you can qualify for shoes, or see a podiatrist that deals with shoes. Something very easy to do. Once again, the recommendations: yearly foot exam by a podiatrist, diabetic shoes, every 2 to 3 months routine care, and then a daily foot evaluation. Let's go on to look at some of the reasons why foot wounds don't heal fast. I see a lot of people with diabetic foot wounds, and you may be looking at this because you have a foot wound. And there are really 4 main reasons. I learned this in residency from one of my colleagues. And there's 4 reasons why foot wounds don't heal fast. We're going to go over those 4. If you can do these 4, you're doing pretty good. But also, if you want to learn more about this, I put together a website called healmyfootwoundfast.com. It has all of this and a lot of other information on it. So let's go look at the 4 reasons. First, your blood sugar. If your blood sugar is too high, you're going to have a hard time healing your foot wounds. So you need to really take care of your blood sugar, and as well as your nutrition, especially your protein level, to make sure that you're eating enough protein. Next, if you have any swelling. If you have swelling in the area of your foot, that can be a cause for poor healing of wounds, as well as if you have poor blood flow. This is an exam called an anchobrachial index. This is used to determine the level of the blood flow in your foot. And if you have some clogging in the arteries, like this picture here, that can be a problem for you. So you have to see probably a circulation doctor for that. So a story of a patient of mine that had poor blood flow, and he was being treated for a wound. He was taking pills by his mouth, and the pills didn't work, and we were wondering why. And ultimately it ended up because he didn't have enough blood flow, because the pills needed to go through his bloodstream down to his foot, and it didn't get down there. So if you have poor blood flow, you may need to get IV antibiotics in the hospital. The next reason wounds don't heal is because people have neuropathy and they walk on their foot. If you don't have any pain, you're going to keep walking on your foot, and that's going to become a problem because the foot wound isn't going to heal. So you really need to get you have to be aware that you have neuropathy, and you should totally stay off your foot, whatever method of doing that you'd like to do. And then as well, if you have a deeper infection. If you have a deeper infection, if the ulcer goes down all the way to the bone, I had a patient recently, she had a wound to the tip of her toe, and that tip of the toe, it healed up, and then it opened, healed, and opened, and ultimately she had a bone infection to the tip of the bone. So even though the antibiotic would heal the infection, the bone kind of housed the infection in there, and it kept coming back. So those are kind of the four main reasons. Those are the big things. There are other things too, but I always focus on those. If you can keep the pressure off the foot, keep your blood sugar under control, take care of your blood flow, making sure you have enough blood flow, and then make sure there's no infection, most foot wounds will heal. Once again, if you want to learn more, there's a diabetes toolkit that can be found at drpelto.com, and there's also another website called healmyfootwoundfast.com. There's some diabetic foot care recommendations, once again, very, very important to pass on to you. So hope you found this helpful. If you'd like to learn more about the diabetes, I would really recommend the diabetes toolkit. It's nice and easy. Just sign up for it, and I'll send you all the information. Okay, have a great day.